Ambien. Ambien is a sleep drug. Basically, if you find it hard to go off to sleep, click like that, like some people do, or it takes you forever to go off to sleep, the doctor can recommend Ambien. Now, Ambien is a fairly good drug to sort of fall asleep on, but I think when I was taking it, this might sound really silly, but when I was taking it, I think I took it for about 3 to 6 weeks after seeing the doctor, and I should have gone back to the doctor. But anyway, when I was taking it, I started getting really, like I've been stung in the throat by a bee. It was hard to swallow and all that sort of stuff. But the end result, and this is what you're watching this for, is that while taking Ambien, at one severe point, I started having delusions like LSD. I was talking to my wife, and I was mowing the lawn, and all these things that weren't going on. I was very the psychosis, I would say, afterwards was very paranoid in many different ways, and I could hear footsteps in our hallway on the wooden floor, and there was a lot of little crazy scenarios going on in my mind. So I rang and I told the doctor. Straight away she told me I had to go to the hospital and deal with it. So I went to the hospital, and this was near Christmas this year, and so I went to the hospital and they put me in the hospital for the night. But I actually stopped taking the Ambien 2 days beforehand because it was my mind was going a little bit batty. So anyway, that's Ambien. It can be a good drug for some people, and it can help them, and it can send them to sleep. I'm not sure of the milligrams, but I think I was on a higher dose. But the part was that it sent my brain into like a psychosis. I have to remember also that I do take other medication, for health issues, and Ambien on top of that, I think actually tipped the scale, and I wasn't in control for a little while. But I'll tell you what, to go to hospital just to go for the night, must have been about 3 o'clock in the afternoon, 4 o'clock. We went in on admissions, and to stay there, like to wait and wait and wait and then get taken up to the ward at night, stay there overnight wearing my little blue jumpsuit, as they call it, like hospital issued pants and top. I think they put me up in the druggie ward because that's what happens if you've got psychosis. It's a drug related effect. And yeah, it must have cost something like $30,000 just to stay one night, and for them to give me a bottle of shampoo, toothbrush, and a few other little knickknacks along the way, that was like $500 on the bill, maybe for a pack of stuff that was only worth less than $10. So anyway, that was my hospital experience. If you do experience psychosis or weird thinking or seeing things that aren't there and so on, and you take an Ambien, talk to your doctor. Don't sort of sit around and suffer about it. I should have stayed in hospital at the time longer, but Christmas was coming up, and there wouldn't have been a doctor there till after Christmas, Boxing Day after Christmas. So I left the next day about 5 o'clock or so, 6 in the afternoon, And yeah, it was pretty expensive for the insurance to pay, and then they wanted me to pay the difference. So Ambien, stick it up your ass. But it was a good drug at the time, you know, that was helping me go to sleep. But it was doing a lot of weird brain things.